Good afternoon, everyone. Alisa Haushalter, Director of the Shelby County Health Department. I want to welcome you to the Joint Task Force update for today. I'm going to give data updates as we always do, make a few comments about vaccine administration, and then Dr. Randolph's going to have some additional updates, and then we'll open it up for questions. As of this morning, we had 75,016 cases of COVID-19 in Shelby County. That's an increase of 508 over a 24-hour period. And at this point, unfortunately, we've experienced 1,046 deaths total. Our test positivity rate for this week has been at 17%, so still high. But we are seeing some changes over the past several days and up to the past week, in knowing that we are, one, beyond the Christmas surge, now moving beyond the New Year surge and beginning to see some plateauing of data. While that's promising, it's really critical that we continue to stay the course, continue to mask, social distance, hand wash, and for those who are able to work from home, to minimize travel, and then to get tested and know what your status is. And for those eligible for vaccine, to be able to get vaccinated as soon as you are able to. I want to talk specifically about our indicators. So our 7-day average of new cases per day is still above 600, so that's 623. And again, while that's stabilizing, it's still well above the target of 450 or less per day. For our 14-day average is at 638 new cases per day, and that's continued now for some weeks to be at that level. What is promising is that our reproductive rate has decreased slightly to 1.03. We want to get that at 1 or below, but it has started to decline slightly. And again, our positivity rate is above 17%, which is much higher than the 10%, and then ultimately want to aim for less than 5%. What we also have been doing is looking at what the cases would look like in a week, a month, and so on, based on the current reproductive rate. And we do know with a reproductive rate of 1.3 and the active cases being 7,970, so that's people who are actively infectious today, over 10 days we would expect 7,112 new cases. Over 20 days, 13,792 cases, and over 30 days, 19,919. I like to share those numbers because it is a reminder that anytime the reproductive rate is above 1, that we will continue to see exponential growth, and that collectively we can bring that down as we did in the spring by taking all of the measures that we're all familiar with at this point. In regards to testing capacity, we still have significant capacity in our community, and we encourage people to know their status and get tested on a regular basis. We also know that the hospitals, while they are experiencing somewhat of a surge, again, post-Christmas and post-New Year, they have seen some stabilization as well. And we want to assure the community that for those who need services, there's the ability to seek those services at our local hospitals. Within public health, we are looking to really focus our contact tracing efforts in a very narrow way when we have the first case of the UK variant, which is the B117 variant. We know that that is more transmissible, and so we are monitoring through the laboratories what would be indicators of that variant so that we as a health department can respond very quickly and get people isolated and quarantined in a timely manner. We're also looking at how we use technology to do more of our notifications and contact tracing through texting and text app. So more to come on all of those. But really where we're focusing a lot of effort, one is, again, contact tracing, still focusing on enforcement, but also on vaccine distribution. We received notice from the State Health Department on Friday that we would receive in Shelby County 8,900 doses of vaccine each week for the remainder of January. Those 8,900 doses are divided amongst the health department and all of the healthcare systems. So there'll be some variability week to week on how much the health department has for public distribution, But at the current time, we have filled up every appointment slot that we have through January. We're eagerly awaiting several things, one from the federal government and the state government. First, we know that HHS has changed its guidance literally in the last few hours. That guidance will trickle down to the state level, and then our protocols may change locally based upon that. We also anticipate with change in the administration at the federal level, there's a likelihood that there will be increased supply of vaccine. So we really encourage everyone to continue to stay on top of the communication. Really, the health department is going to have the most recent information, particularly about the allocations to our county. And we encourage you to go to shelby.community. That's update each day by 10. We also send out our daily updates, and that'll include the most current information, and then we will update via the press releases as well, and do a more formal press release if there's any change along the way. We are currently vaccinating those individuals from Category 1A1 and 1A2, and we will expand those as we begin to exhaust these particular populations. Also, I also ask everyone to remember we are the largest county in the state, so it'll take us much more time to get through each of the phases before we open publicly. So I'm going to end there and turn it over to Dr. Randolph, who's going to give some additional updates.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the Health Officer for Shelby County Health Department. I don't have much to report, just a reminder that we only have a few more days. Matter of fact, we only have 10 more days before January 22nd, when the stay-at-home or safer-at-home health order will end. I just want to encourage everyone to remain steadfast, continue to adhere to the safety measures that are in place, and that we are closely looking at the data to determine what would be our next steps, and so more to come on that. The other thing is I want to remind everyone that although you may have received your vaccine, you still must adhere to the safety measures. Do not assume that you go get your vaccination one day and then the next day you can hang up your face covering face mask and you can no longer practice social distancing. It is very important that we still hold fast to these practices that become very important. So I don't want you to have a false sense of security thinking that, oh, I have been vaccinated now, so I'm okay. And so with that, I will stop and entertain any specific questions you may have.
Kelly Roberts, WMC.
Good afternoon. My first question is about vaccines. Regarding vaccinating people of a certain age, it sounds like the CDC may be recommending that states start vaccinating those 65 and older. I know that we're doing a concurrent thing right now in Tennessee with vaccinating those 75 and older at this point. Is it likely that age will move down with these new recommendations? You know, that obviously it's more people to be vaccinating at this point in Shelby County. How likely is this?
Okay, I'm going to let Dr. Haushalter add to this. But one thing I want to say is that pretty much we follow the guidance from the state. And so we will await their guidance. I'll let Dr. Haushalter add to that.
Thank you, Dr. Randolph. I don't really have much to add. We are clearly keeping up with the federal guidance and then always wait for that to trickle down to the state level. And so we have to wait for that guidance to change in writing. However, the plan always has been once we got through those 75 and above, or, most of the way through, then to start opening it up to other populations. So we'll await the new guidance and make adjustments accordingly. I'll reiterate what I said earlier, is this changes day to day, moment to moment. Everyone remembers at the very beginning of the pandemic, there was new information almost every hour. And so this is evolving, and we're continuing to pay attention. We have regular contact with the state health department. We'll make adjustments accordingly and then communicate that out via our regular daily communication so that everyone's aware of what's changing and what that means for them particularly. You have a follow-up?
Yes, and this is about the surge that we saw after New Year. So it sounds like we're kind of getting over that hump, as you said, and some data starting to plateau. What's the next when it comes to thinking about loosening any restrictions or anything like that, being that it seems like we are getting past the holiday surge and New Year's surge?
So our daily cases on average are still much higher than they need to be, and our reproductive rate is still higher than what it needs to be. So at the current time, we will continue with Health Directive 16 through the 22nd. We do not anticipate at this point that we're going to make any interim changes. And then as we get towards the 22nd and continue to monitor the data, we'll make some other adjustments accordingly. And there are a variety of things that can happen. We can continue the current order, we can revise the current order in a sort of moderate way or in a more extreme way. So we're considering all the options. We're going to continue to monitor the data and use that as our driving force. I want to reinforce to everyone that there are critical decisions that individuals make that reduce transmission. That's masking, avoiding contact with large groups, and so on. But there are also decisions that employers make that we know influence our cases locally. So I really urge employers to make sure they're doing everything they can to create a safe workplace, to support employees who are placed in isolation, and to support employees who are quarantined, and assure that people are masking in the workplace. Thank you.
Michaela Watts, Commercial Appeal.
Yes, good afternoon. I wanted to ask a question about the hospitalizations. We were at a pandemic high last week at 661, I believe it was, last Wednesday. Now we have 579 patients in the hospital per the latest data. That's a little over a 12% increase, and I wondered if you had any insight as to why we saw such a decrease, and I'm hoping that the answer is not because of increased fatalities.
Yeah, it's not because of increased fatalities. There's a few things. One, we know that people typically begin to be ill about 5 days after exposure, give or take a few days, but generally around the 5th day. And then it may be another 5 or more days, so you're getting towards day 9 or 10, before people seek medical care if they need what would be emergency care or urgent care. So you typically see that increased hospitalization relative to a surge a little bit after the increased positivity. And so that's what we experienced. Many of the people hospitalized, obviously, it's a reflection of the holiday transmission that we did predict. Keep in mind also we're receiving patients here from surrounding counties and surrounding states. And then the decreasing number is a reflection of the fact that we probably are now decreasing our number of cases slightly, which then impacts hospitalization. So it's a positive sign. It does reinforce that all the measures that we've taken in Shelby County has reduced the impact of the holiday surge compared to some other communities.
Great, thank you. And just a quick follow-up about, about vaccines. We know that this morning the Trump administration reversed its previous stance. It is now releasing all vaccines for first doses. Are there any drawbacks to not having that second dose stash of vaccines?
You know, it's really going to be two things that we'll have to pay attention to locally is one, ongoing supply from the federal level, so that if everything is released early, there's an assumption that the supply chain is going to improve and we will have opportunity for the second doses at a later point. And then the second is that at the current time, there is not adequate research to really guide us locally on the value of only one vaccination. There is some literature that says you can receive the vaccine at a later date and it still be effective. So we'll be monitoring the science and the data and information that comes out of the FDA, what is approved or not approved, and then closely monitoring the supply chain. What we do know is Shelby County, if you compare us to other communities, is actually getting a larger number of vaccines for two reasons. One, we have the larger population, and the second is that we have a higher social vulnerability index, which means we have more people at risk, and so we actually are getting a large amount. But if you consider it, 8,900 doses is really not significant. So the more vaccine we can get, the more people we can get vaccinated, and then we can begin to worry about the second dose at a future time.
Brad Broders, Local 24.
Thanks, Dr. Haushalter. Just following up on what Michaela just asked. I know obviously today the Pipkin building vaccination started by appointment. Is it the belief of the health department and the goal that 3 weeks from now, those getting doses today, tomorrow, will be able to have the supply to get a second dose?
That's our goal, with the caveat, if there's a change in the protocol, then we will adhere to the change in the protocol. And just as we were learning at the beginning of the pandemic, we are all learning about the vaccines. And so we expect changes from the federal level to occur. We also are looking for when other vaccines come into the pipeline, and that'll change the equation slightly. But at the current time, the guidance is that people have to receive a second dose. We will be looking for that supply to come to be able to assure people get the second dose unless that changes. And you have a follow-up?
I do, Dr. Haushalter. I know you were just mentioning the variants, but what are the plans for the health department in terms of any more intensifying contact tracing to obviously, when that first case arrives in the county, to really limit the spread of that?
So one of the things that's really important is the surveillance piece. So we have to get notice that first potential variant strain patient or case is identified, and that's really our laboratories that are taking the lead on that. Everyone knows in Shelby County we've not had any challenges with testing from the beginning, and that's a testament to our labs, both our private labs and our academic labs locally. Those same laboratories are assuming leadership to be able to do what we call fingerprinting or DNA sequencing locally. And they work closely with healthcare providers and the health department to report to us. So the critical thing will be that immediate detection that this is a potential variant. Once that happens, that specimen will be sent for additional sequencing, but a notice will come to the health department actually by phone call. So everyone knows we're relying on the databases to report. This will actually be a verbal report to either David or Jennifer Komet, or two lead epidemiologists, and then from there a team will be deployed to interview that case and identify contacts very quickly and get those contacts not only in quarantine but tested and their specimens sent for fingerprinting. Something else that we'll do that's a little bit different is we will do what's called a two-way investigation. That means we're going to look more closely at their exposures prior to illness and potentially do testing from those who might have been, the person may have been exposed to during their exposure period. And then we will also give public notice so that the media has the information and the public has the information that we do have the strain here and what that means for us as far as taking extra precautions. So we're prepared. We'll keep our fingers crossed that we don't have that first case, but if we do, we're all prepared to move relatively quickly to reduce transmission.
Katie Reardon, WKNO.
Hi, Dr. Haushalter. I was wondering if you could talk about, is there a plan in place if someone cancels their appointment, who fills that and in order to use up all of these doses?
Good afternoon, a great question. So several things will happen. Clearly, there's always a percentage of people who don't show up. The likelihood that they'll cancel is probably low, but they may not show up, or others may show up early. So that's generally considered in the throughput per hour. but also we have a list of individuals and groups that we can call upon if we see that the vaccine is being underutilized. That's going to be more critical with Pfizer. And then the other thing I wanted to note is that the mayor's office and our IT team is working on a way that people can electronically be put in the queue, or if they call us, we can put them in the queue for immediate notice if we have an open slot so that we can work them in. This week we're administering Pfizer. You know, we used Moderna previously, so we're watching the doses very closely throughout the day. And at the end of each day, it really is an assessment of what went well, what could we do differently, and how do we make sure we're getting vaccine to the people that need it. You have follow-up?
Great. I do, yeah. And so I know that you guys have asked sort of for a proof of ID or proof of a letter from an employer to sort of prove that you're eligible. How strict are you going to be with that? And then I'm also wondering, how would that work for somebody who is undocumented?
So what we've actually communicated is be prepared that we might ask for that. One of the things that we learned from the very first week, and the media, you know, told some of this story for us as well, is that people got in the line who were not eligible yet for vaccine. It caused significant delays, but also some of those individuals just refused to leave the line, which then required law enforcement to take time to assist with that. So we want to really encourage people who are eligible to come in the line. So we just want to let people know, be prepared that we could ask for it. The other is that may change as well based on state guidance. And then lastly, from our perspective, we want everyone in Shelby County who is eligible to get vaccine to get vaccine. That eligibility is by age as well as by type of role or employment. And so regardless of someone's country of origin or whether they're viewed as documented or undocumented, they're eligible for vaccine, and we want to encourage them to come get the vaccine.
Jacob Steimer, Memphis Business Journal. Okay, we'll come back. Dominique Dillon, Fox 13.
Hi, I know you mentioned there's little data on what could happen if people don't get the second vaccine, but if they don't, what can they expect from your knowledge?
So again, the research is still out on that. What we do know is that based on FDA approval, people should get both doses. The question becomes the time frame in which that second dose has to be administered. So the takeaway is if you've gotten the first dose, you need to strive to get the second dose. If for some reason you missed the date that you were scheduled or planned to get your second vaccine, you should still get the second one even if it's past that date. Can you follow up?
No, thank you.
Thank you.
Omar Yusuf, Daily Memphian. Okay. Stacy Jacobson, WREG.
Hello, can you hear me?
Yes.
Okay, great. Thank you so much. Thank you, Dr. Haushalter. Question about the federal pharmacy program. Are they administering vaccines in Shelby County right now? And do you have any comment on the very large number of doses that have been allocated to that program that have seemingly not yet been distributed? About 175,000 doses.
So I'll speak to what I know about the program and really encourage the pharmacies to actually speak on their own behalf. And then I'll also give an update on our vaccine subcommittee. So we do know that at the federal level, there's been agreements with various large pharmacies to be able to distribute vaccine to vulnerable populations, particularly those in nursing homes and a few other smaller groups. Our understanding initially was they were going to receive vaccines somewhere around the second phase, but I do understand some pharmacies have already received vaccine and either have or working to administer that vaccine, particularly in the nursing home setting. What I want to note is that, and I think we've shared previously as well, we have sent strike teams to nursing homes that did not have agreements with the pharmacies. That is a very extensive task because it does take a longer period of time. It's not like the drive-throughs where just multiple people come in through hours, 1 hour at a time. And so we just have to be prepared. It'll take a while to roll out. The other is that within the Joint Task Force, we do have a vaccine subcommittee that Dr. Jane and I convene. Right now, we meet 3 times a week, and in that particular meeting originally was the health department as well as the healthcare systems, but the pharmacies are going to join us as well, and that'll help us have a better understanding in Shelby County. One, how many doses the pharmacies have, and what barriers they might be facing to getting that vaccine out, and how we collectively through the Joint Task Force can assist them. So I would encourage you really to reach out to the pharmacies, but also know that we'll have some additional information probably in a week or so, and perhaps could even have representatives from the pharmacists join us on one of the press conferences.
So can you confirm if the federal pharmacy program has administered any vaccines in Shelby County at long-term care facilities?
No, I can't confirm that because I don't have exact numbers. I just have information that was reported to me secondhand about some challenges in scheduling those, but I don't know if vaccine has or has not been administered. We will have that information later in the week or the early part of next week because we'll be meeting with the pharmacies to ask some of those specific questions.
Omer Yusuf, Daily Memphian.
Hi, can you all hear me?
Yes.
This question is for Dr. Haushalter. You talked briefly last week about ways that the health department is looking into to ensure equitable distribution of the vaccine, especially in maybe lower economic areas. Have you all made any progress with that, or any sites that you are close to announcing?
Just a few things. One, I would say trying to achieve equity is you never arrive. You're always learning through each day what you can do differently to better serve the community. So one of the things that we did locally was obviously we have the online sign up, but we also had the telephone number that people can call in. And moving forward, we'll use both strategies. There are some locations that we may also just open it up and not require an appointment to assist with people moving forward. And then we do have some other sites that we're in a contracting process that we anticipate being able to open up either before the month is out or the beginning of February, depending on the vaccine supply that we have. And then we'll also do some pop-up sites. And then we are in conversations with the municipalities to be able to do things in each of the municipalities to serve their constituents as well. But I also encourage people who have ideas to please reach out to us at Shelby TN Health so that we can take those into consideration as well. You have a follow-up?
I do not. Thank you.
Thank you.
Okay, looks like we're out of time. Are there any closing messages today?
I just want to say thank you to the public. We know this has been a challenging holiday season, particularly with additional restrictions and encouraging people to limit your gatherings over the holiday, which is not what we're accustomed to, but we are seeing some light at the end of the tunnel. So just want to thank everyone for their efforts and also acknowledge everyone in the Joint Task Force who has continued to come together now for many months to be able to serve this community and help us get through the pandemic response. Thank you.
Thanks, everyone. We'll see you back here on Thursday.